Good evening, everybody. Welcome to another installment of the HND webinar series. Thank you all for attending tonight on what promises to be an exceptional balanced exercise class with our Director of Rehab of Vestibular Rehabilitation, Justin, who I will introduce you all to in a minute. As we age, most of us, as you know, lose some balance and coordination and flexibility, and so it's easier for us to fall, which is a major problem that we see in the clinic every week. So there are a number of steps that you can do to reduce your risk of falling, and that's what we're going to talk about today, specifically to address those deficits. We're going to talk about stretching. We're going to talk about meditation and breathing. Justin's going to show you some balance exercises, some strengthening exercises. And before we get into it, I just wanted to give you a little bit of background. So Justin is a licensed physical therapist with a bachelor's and master's degree in health sciences and physical therapy from Boston University. He's worked at Northwell Health as a lead physical therapist for their inpatient and outpatient brain injury rehab program. He's currently the director of vestibular rehab at H&D Physical Therapy and focuses on working with people with balance, dizziness, and neurological conditions. He is passionate about helping people with mobility deficits achieve greater independence and reduce their risk for falls and improve their quality of life. This is being recorded, as you know, and once we finish today, we'll send it out in a couple of days or a week, and so you can refer to it at any point. But like I said, if you have any questions, just shoot it to me through the chat, and we'll pause throughout to answer it. So, Justin, why don't you take it away?
Thanks, Aaron. So I'm Justin Ettinger. I'm the director of vestibular and balance therapy at H&D Physical Therapy. So I specialize in working with people with issues with balance, dizziness, vertigo, falling, mobility issues. And I also co-lead a weekly balance and exercise class Fridays at 3 o'clock. Right now it's being held on Zoom. So this is what I'm really gonna be showcasing today. So this will be less talk, more moving around. So today we're going to be exercising various forms of exercises. If you were at my last webinar, I discussed how research shows that exercise is extremely beneficial at helping reduce risk for falls. But not only any exercise, multi-component exercise. And that means exercises that target your strength, your flexibility, endurance, and most importantly, balance. So we're going to try to touch on all of those areas throughout this session. So some housekeeping items. The only piece of equipment you need today is a chair. So a sturdy chair would be is going to be used. There's going to be some sitting down components of it, and then you can use the chair or the back of the chair to touch if you need for any kind of losses of balance or just to help you feel safe. So it's highly recommended to either be barefoot for the session or to wear sneakers or some supportive footwear. I would highly recommend to try to avoid wearing only socks or slippers or anything with or sandals because you can slip with any of these exercises pretty easily. And then lastly, so safety first. So if you feel like you need to touch the chair for any or all of the exercises, that is totally fine. You still get a lot out of balance exercises if you need to touch. Also, none of this is meant to be painful. So if you are having pain, either stop the exercise. I'm going to try to give modifications for the different exercises, but right now we have 57 attendees, and this is not an individualized exercise class, so please be mindful. If something doesn't feel right for you, don't do it. This is just kind of suggestions and options. So we're gonna all start sitting in the chair. So I'm gonna be performing the exercises in the as well. So we're gonna sit. And we're gonna start with our feet. So our feet are the first thing that touches the floor with our balance, right? And that's where we're gonna start. So we'll do a little self-massage. So the option is either to pick up your foot if you can, and just to kind of give the soles of your feet a nice massage. If this doesn't work on your hips, you can always lean forward and massage the feet. You know, I'm gonna pick my foot up and just kind of get the toes, get the heels. Kind of wake up those nerve endings. And then we can go up the calf. Your calf muscles and the muscles in the front, the side and the front of your shin, kind of just to the side of the shin bone, are very active when we balance. Just kind of waking it up a bit. You know, bring the foot back down. Just kind of get waking up those quads, maybe the hamstrings under the leg. Good. And then we can switch feet. Either you can bend and massage that way, or you can pick up your foot. Just work on the other foot. And then up. You can go up the calf. Just give it a nice squeeze. And then to the side of the leg, or the lower leg. Feel those muscles. And then we can bring the leg back down and just kind of wake up the front of the thigh. And the back and the hamstrings here. All right, legs are done. Just gonna adjust my camera. And we're gonna go more to the upper body. So we'll take your right hand, and you just kind of go just above, under your collarbone. Just kind of, these muscles can be pretty tight. And kind of work out by the shoulder. Get a nice massage there. And maybe the neck, the back of the head. Not only is this a nice way to kind of, we're increasing blood flow, we're getting these nerve endings sensitized. It feels good too. So we can go down the arm. You know, right now, this is the safest way to get a massage these days. Go down to the hand, into the palms. And then we'll switch to the other. So oops, wrong hand. So we're gonna get the other. By the chest, by the shoulder. This is usually a pretty tight area. Maybe up over the neck, over the head, and then down there. Give it a nice squeeze down the arm, waking up those muscles in the hand. All right. So let's rub our hands together, create some warmth. And then sitting up nice and tall, you're gonna place your hands on your stomach. Okay. Just gonna take a couple deep breaths in and out. So as we breathe in, imagine your belly is a balloon and your hands are expanding as you're breathing in. And when you're breathing out, they're coming back together. All right. So we're gonna get our hands on our thighs. If you can, sit up nice and tall. And you have the option of either closing your eyes or just softening your gaze. And for 30 seconds, we're just gonna breathe. Right, just focusing on our breathing. You can open your eyes if they're not already. It's a simple meditation, right? Just staying in the moment. Balance exercises I find are a great meditative activity. You know, we really got to focus on kind of where our bodies are, and it's tuning out everything else that's going on in our minds. So it's, I find it very helpful. So let's all come around to the back of our chairs. So we're going to do a little calf stretch. So I'm just going to move this so you can see me. All right, I'm going to grab the chair and let's step back with the right leg. And the front leg, the left knee is bent, right? All toes are pointed forward. And you're going to lean a little forward until you feel a stretch on your back leg. Maybe by the heel, maybe behind the knee. And we're just going to hold it here, maybe 10 more seconds. These calf muscles get a lot of work when we balance. So I want to get that first. All right, we'll step forward with your right foot. And then we'll step back with your left foot. And so the right knee is going to bend. The left leg is straight. All toes pointed forward if you can. And we can lean a little forward if you want to deepen the stretch. Five more seconds. All right, step the foot forward. And just gonna move stuff out of the way. So we're all gonna stand either the back of your chair or next to your chair, whatever feels right. Let me just point my feet. I'm gonna get my chair away so you can see me better. We're all gonna stand, if you can, with our feet together. You know, if this doesn't feel good at all, if this is not good, just bring your feet a little apart. Right? But the closer together, the more of a challenge. So I'm going to stand nice and tall, keeping your feet together if you can. Look straight ahead. And if you can, if this feels okay for you, I'm going to try closing your eyes. Only if you feel like you can. It's challenging to close your eyes for your balance. So everyone be careful. You all signed your waivers. Your eyes, it's totally normal to sway, especially with your eyes closed. And we'll keep your eyes open here. And then I just want everyone to take a moment to try to set an intention for today's class. Just something in your mind. Like my intention will be to try to stay focused and present with y'all, and not be thinking about all the other stuff I need to do later, right? All right, so we'll separate our feet, and we're gonna go right into some more balancing. So you're gonna be next to the chair for support, just in case. And we're gonna be kind of stepping up, standing on one leg for a moment. So what I'm gonna have you do, the standing leg is gonna be the right leg. So we're going to shift over to the right, and pick up the left leg and then put it back down. And let's try it again. We're going to shift and lift. One more time like that. And back down. So we're going to make this a little more challenging. If you can stick with that if that was challenging enough, or we can make it more challenging. So we're going to go, if you want more difficulty, we're going to go 3 directions. So we're going to stay with lifting the left leg. All right, so forward, back down, to the side, back down, and then kick back and back down. So try to avoid leaning forward or leaning back. So you're going to stand nice and tall. So forward, side, and back. And I'm going to face the other way so you can see what back looks like. So forward, side, and back. Right, we're going to go 5 more of those. Forward, side, and back. So feel free to touch the chair whenever you need. 3 more. If you want to make it even more challenging, you can try not to put your foot down each time, but that's hard. Good luck. Side and back. Good. All right. I don't know about you, but my right leg is feeling it. So I'm just going to shake it out a little bit. And then we're going to do the other side. So the standing leg is going to be the left leg, right? And your first option, you can just bring the leg up. So we're going to shift to the left, pick up the right leg, and put it back down. So that's the first option. Feel free to touch the chair whenever you need. Or I'm going to take you through the other round where we're going to go the three directions. Right? So we go forward, side, and back. And it's totally normal for one leg to feel easier than the other. We all have different things going on. The knee that the leg that you're standing on, I meant to say before, don't keep it all the way locked. You don't want a locked knee. You know, you want to keep it a tiny bit, a little bend. You want those muscles to be working. Let's go 4 more cycles like that. Feel free to rest, stop whenever you need. Two more. Last one. All right. My left leg is feeling it, so feel free to shake it out. Woo. All right. So we're going to move on to something a little different. I'm just going right along to that. So this is going to be more of a stepping exercise.
Justin, can I just stop you for a sec?
Sure.
Because I have a couple of questions, but I don't want to interrupt your flow. Is now a good time?
Sure.
Okay. So going back to some of the first exercises that you showed us, specifically like the massaging part, I'm so glad you brought that up because I find that a lot of our patients have such stiff feet and they have trouble feeling the ground, which causes a lot of like their balance impairments. So the fact that you showed a good way to massage the foot is super important. Are there other things that you can recommend besides that might help improve people's balance, just starting from the foot up?
No.
Like in terms of like stimulation, like rollers or like pads pads or insoles or anything like that that you think might help?
We like to use a little ball in our balance
Mm-hmm.
test. So, I mean, a tennis ball might be a little too soft, but um, kind of roll your foot on a ball. That's a nice way to get those
Mm-hmm.
nerve endings going um, without having to bend and to, to use your hands. And then for the legs, we have um, different kinds of rollers, almost like a rolling pin, right? That you can use on your legs. That's pretty good.
Right. Okay. Another question that came in is some of these exercises, even the simple ones that you just showed, the standing on one leg and moving the other leg out, can be really tiring. And so people want to know, like, when should they stop, if at all? Like, what's good pain versus bad pain when it comes to that? I mean, should they just continue to do this even if it's like really hard, or should they stop?
So for balance exercises, right, if you, in order for it to be an effective balance exercise for you and for you to improve your balance, you need to get a little off balance. So balance wise, it would best to be a little more challenging and for you to struggle a little bit. But that's different from pain. We don't want this to really be painful. I mean, some soreness is for some people is normal, and everyone's going to be different. It's hard to say an answer to that for everyone.
Mm-hmm.
Depends on what's going on, but ideally this shouldn't be painful. But being off balance is not a bad, as long as you're staying vertical, right? That's the goal of
Right.
it. We want to stay vertical, but we want it to be a little challenging. It's not
And,
doing anything for you on your balance if it's too easy.
awesome. And final question. Some people have a harder time on one leg versus the other, like if they're dominant on one side or the other. And you don't have to answer this question now. Maybe it'll become clearer towards the end of today. But if there are certain exercises that people can do to help strengthen one leg versus the other, either hip or glute or something like that, could you let us know? Because there's definitely some asymmetries here that we find between legs.
You probably would want, if you're noticing significant differences and you haven't been seen by a physical therapist, it's probably a good idea to get evaluated, and they can help you get on an individualized program for you to work on those weaknesses. Well, on one or two of the exercises later, I'll show you ways to maybe work one leg compared to the other if you're noticing some more weakness.
Awesome. All right. Carry on, my friend.
All right. Back to work, everyone. So we're going to work on a stepping exercise next. So I'll show you my feet first. You can see a lot of my feet today, sorry. So your feet will be about hip width apart. And so first we're just going to, this is your feet, your right foot's going to step forward and back to the middle. I'm going to try that first. So that's what the foot's going to do. I'm going to point up because I need a cameraman here. So your right foot is stepping forward, and let's reach forward with both hands, almost like you're giving someone a hug, right? Or pushing someone away, whatever you want to visualize, right? So we're stepping and reaching outside of your support. If you're feeling off balance with this, feel free to touch the chair with one hand and reach, or don't reach as far, right? To make it more challenging, you can reach and step further. So a few more. One more. All right, so then we're going to step the other foot. Left foot's going to be going forward and back, and we'll do the reaching there. All right, so we'll step with the left, reach forward. Feel free with one hand if you want. trying to control our balance as we're stepping and coming out of our support. A few more here. One more. All right, we'll start to get a little more challenging. So I'll show you my feet. So now we're going to step to the side. So we'll step to the side with the right foot, like that. So that's what the foot's going to be doing. You can either keep it straight like this, or to make it more challenging, you can point the right toe out a little bit. All right, so that's what the foot's going to do. And then we're going to, as we're stepping with your right hand, you're going to try to reach out. Like you're trying to grab something. Okay. Feel free to touch the chair if you need it. To make this more challenging, you can look at your hand as you do this and look what you're reaching for. It's more challenging, so careful. One more. All right. So we just had our first exercise where we turned our head a bit. And so sometimes turning the head can make you dizzy. So a little dizziness is not a terrible thing if it's coming from a vestibular condition. But dizziness from other issues, just you want to be mindful that you might want to stop if you're feeling too dizzy. All right. So we're going to go to the left foot to the left. Same thing, we're going to try to bring the arm up out to the side. To make it more challenging, right, you can turn your head to look at your hand, see what you're reaching for. Two more. All right. Looking good. The last one of these, and this is the challenge. So if this doesn't seem good for you, don't do it. Take a rest. We're going to step back next. So the right foot's going to step back and then bring the foot back to the middle, right? But if this is what feels good for you, then stick with that. To make it more challenging, if you feel like that's too easy, as we're stepping back with the right foot, try to reach back. So I'm twisting a little bit to the right and coming back. If this isn't good for your back, don't do it. If it's not good for staying upright, don't do it. If this is easy, then you can try to look at your hand as you do it. Our vestibular system is important for our balance. So when we turn our head, as we move around, your inner ear has to sense where we are. So this is stimulating that. All right, enough of that. Let's rest a moment. Give our vestibular system a break. And then we're going to step back with the left foot. Right? And then back to the middle. So we'll step back, and if you can try to reach to make more challenging if you feel like that's going to work for you. Or to make it more challenging, you can look at your hand. All right, enough of those turns. Give your head a break. We'll go one more little balance exercise, and then we'll pause for any more questions again. So I'm going to be by your chair. Going to kind of get some space to do this. So we're going to try to walk 1 foot in front of the other. This might not work for everyone, so don't do it if it doesn't seem right. But you can always touch the chair the whole time, right? So we're walking 1 foot in front of the other. When you get away from the chair, I'll have you turn around and do the same thing on the way back, right? If this is not working and it's too difficult, you can put more space, right? I'll just show you this way. You can put more space in between your feet so it's not exactly in front. That's a way to make it a little more easy. It might seem like you should be looking down to see where your feet are, but it actually looking down is not good for your balance, right? It throws your posture off and actually usually makes things worse. One more time, one more lap. All right, rest time. All right, Aaron, any questions coming up?
Well, that one looked a lot like a sobriety test there, Justin. And I know it's 5 o'clock somewhere exactly, 5 o'clock here. So if you haven't had any drinks or cocktails at the moment and you're still falling, feel free to take wider steps as well. You don't have to just maybe take longer steps, which will help, but you can also try to take a little bit of a wider step if that's too hard.
Can I ask a question?
Sure. Go ahead.
This is Dorothy Wilson. Okay, I'm often no dog, but that's because it's better for me to focus on something else, not see my picture. A couple of questions. Stepping back, I noticed there was a slight turnout of the back leg. That's okay. It doesn't have to be toes forward, knees forward. Okay. And would side leg exercises like from Pilates be great for the building up the strength for any of the side leg stuff that was probably side and back leg stuff?
Definitely.
Okay. And then the others, I find myself doing Pilates breathing. Can't help it, but I trust that doesn't matter, but it may not be essential. I don't know, but it's very balancing, I think.
Good.
Centering, I don't, for what it's worth. I will shut up.
Thank you, Dorothy. So Justin, before we go on, and again, you can share this with us now or later, but it would be great to get some tips from you about how to improve the safety of our homes. As we know, the majority of falls take place in the house, and so if you can leave us with any tips or suggestions as to how we could maybe get rid of some obstacles at home, that would be great before we're done.
I can do that right now. So, lighting. As you might have noticed that when we did the exercise with your eyes closed, you likely had a little more imbalance. So it shows you how much our vision is important for our balance. So if you're having trouble with balance, improve the lighting in your home if you can. Trying to avoid or remove rugs that are like throw rugs or rugs that you can trip over, right? That's one of the most common places that you're going to trip. Being really careful in the bathroom and the kitchen. Those are the most dangerous rooms in our houses. They're hard floors and often wet or can be wet. If you need to install grab bars by the shower, that is very helpful. Especially if we're standing when we're showering, and we need to close our eyes to wash our face or our hair, or turning the head. A lot of times that can cause trouble. Keeping the homes clean of clutter, and it's not easy, especially in Manhattan. Our homes are not like they are in the suburbs, so we have little space, but trying to remove as much as you can that you can trip over. Yeah, if you feel like you physical therapists, occupational therapists are trained at providing home assessments. So that's another avenue you can go if you have specific concerns, if that helps.
Fantastic. Yeah. And also like you can Zoom yourself in your home and we can take a look at your setup that way.
Yes.
If you're not comfortable
That's
having
true.
visitors.
All right. Should we move on?
Let's do
Can I
it.
make a suggestion? Can I add something to this conversation that I think will be helpful to everyone?
Sure.
I'm an
Please.
epileptic, okay, and I take an anti-seizure medication, okay. I also have AFib, so I take a blood pressure lowering medication. Every issue I have had with balance has been in relationship to when I have a blood pressure monitor. If my blood pressure is too low, I have a balance issue. And senior citizens are given every medication. If you look at for senior citizens, the first element of that it says to pay attention to is that it's dizziness. Okay. And if you're taking 3 or 4 of these, forget it. You're not going to have balance issues. So you have to talk to your doctor and find out that every doctor who's ordering a prescription for you knows what other balance issues you're having and what medications you're taking that cause dizziness. And I can tell you from my own experience, because I was in the hospital about 2 months ago because I fell 3 times, twice in my house and once at a Whole Foods going up an escalator. Okay. And since then, I have monitored my blood pressure carefully and I have no issues. I have no issues getting out of bed, which is the second thing. They say when you're getting up out of bed, get up very slowly, be very careful, which is true. But I couldn't even get up out of bed. I was so dizzy when I wasn't paying attention to what my blood pressure was. So my suggestion, and you guys can disagree, is get a blood pressure machine, have it calibrated, make sure it's right, which I did, and try to find out if your blood pressure is too low. You're never going to get your balance to be right. That's my suggestion.
Thank you, Michael. That's actually, I'm glad you brought that up. Managing your blood pressure, whether it's too low or too high, is actually proven to reduce your risk for falls. And taking certain medications and taking 4 or more medications significantly increases your risk for falls. So how many of us are taking more than 4 medications? That's a lot, right? It's very common.
If you're a senior, that's nothing, okay? And everyone starts with dizziness, okay?
Yeah.
Drowsiness, okay? Well, dizziness and drowsiness is enough of a combination. Who can stand around and do anything? So I carry a cane so that when I go indoors, I can lean on it if I need to, but I don't walk with the cane. I just carry it because if I have to stand in a line somewhere, I want to be safe. But I wish everyone well, but make sure you know what your blood pressure is, because if it gets too low, you ain't gonna be able to balance and walk safely. Okay, that's my suggestion. Thanks for your help, guys.
Great point.
So we're going to move on to just a couple strengthening exercises to switch gears. So just little simple things we can do without any equipment, except a chair. So we're all going to sit back in the chair if you aren't already. So we're going to sit at the edge of the chair. And all we're going to do is perform a Sittostand, which seems easy. We'll start with this. If you need to use your arms for this, that's the easiest way to do it, right? But the things I want you to focus on when you do this is to lean forward as you stand and then stand up straight. And on the way back down, lean forward and control the descent, right? So if you don't need to touch the chair, you can touch your legs to make it a little more challenging, or you can cross your arms. You can bring your arms like this. Lots of different things. I'm going to cross my arms. I like that. And we're going to do some sitting to stand. So I'm going to lean forward, stand up nice and tall, and then lean forward, control the landing, right? Try not to plop down. And don't forget, I can see some of you. If your chair does not feel sturdy, don't do this or put it next to a wall. The lower the chair, the more of a challenge. And so if this doesn't work, you can do it from your bed if it's a little higher. All right, good. Let's stop there a second. So if you want to, if you have a, this came up before, that what happens if we have a weaker leg that we want to work on a little more. So I find this exercise to be a good way to work on that. So if you want to accentuate one of your legs, you can bring one leg back a little bit and bring the other leg forward. So the back leg is then going to be forced to do more of the work. So we can lean forward and stand up, and lean forward and sit down. You probably notice a difference. We'll go a few like that, and then we'll switch legs. We've got to make it even. All right, now I'm going to switch legs. I'll bring the other foot forward. One more. All right, good. We'll do something for our upper bodies a little bit and our core. Well, from the chair. Again, if any of this doesn't feel right for you, don't do it. But the first thing we're going to do is, if you have armrests in your chair, we're going to use the armrest. If not, you can use you can put your hands on the seat of the chair. Now I'm going to use the armrest. So what I'm going to do, this is the first option, is to just push down and try to lift your hips up a little bit and then come back down. You know, if that bothers your neck and your shoulders, then bring your arms down to your seat. You know, just kind of elevate your hips off the chair, right? That's your first option. And we're just going to just hold it there, right? To make it more challenging, we can lift and start, if you can start to slide forward and hold it. Squeeze your stomach muscles, squeeze your butt muscles. Don't forget to breathe. Couple more seconds, and then slowly back and relax. You probably feel that. Pain, not pain, we don't want pain. So if it's painful, we need to somehow modify that, right? Don't go as high, put your hands on the chair, or don't do the walk forward. So we're gonna try that again, right? We're gonna push up, and you can stay here if this is right for you, or you can start to walk a little forward. And if before it was easy, you can try to go a little further if you want. All right, you're gonna squeeze your stomach muscles, squeeze your butt muscles, and we'll walk back and relax. One more, if you can. We'll lift up, and you can either hold it here, or you don't even have to elevate all the way. You can just press down, or we can walk forward a little bit. And squeeze your stomach muscles, squeeze your glutes. 5 more seconds. My arms are burning. And we'll walk back and relax. All right. We'll give your arms a break. Let's all stand up. And we're going to come to the back of the chair. Okay. We're just going to go into a heel raise. I'm going to point forward so you can see a little better. Your feet are going to be about hip width apart. And this is not a balance exercise, so feel free to touch the chair. You're going to come up onto your toes and then down to the heel, the back on the floor. So I'll turn this way so you can see. We're going to go up and down. So something to avoid here, try not to lean, try not to go forward as you do this, right? It's almost like you're trying to hit your head to the ceiling. Touching the chair is fine with this. gonna go 6 more. All right. So I always like to do a calf stretch after we do our heel raise. So let's for the back of the chair. Whoops. We're going to step the right foot back, just like the beginning. Left knee is bent. And just give a nice stretch for the back of the leg. All toes pointed forward. Couple seconds here. And then we'll step forward and then the other foot back. Bend the front knee. The back leg is straight. All right, I'm gonna come forward. So typically we would go through 2 or 3 sets of some of these strengthening exercises, but for today's we're gonna do 1 just to get all the questions in. But we're gonna go into next a little more balanced exercises. So these are gonna be standing still balance exercises. So I'm gonna point to my feet again. And we're going to try to bring our feet together again. So if you need to touch the chair the whole time with this, that is totally fine. So our feet are together. You're going to, keeping your feet together, you can slide your right foot a little forward. Right? So one foot is partially in front of the other. So ways to make this more challenging or less challenging is that the further you go forward is typically the more challenging. The more you go back, it's generally a little more easy. So you can kind of pick where it should be a little challenging, but it shouldn't be throwing you on the floor, right? So I'm going to go about 3/4 of the way up my other foot, right? And we're going to stand nice and tall, look straight ahead, and try to feel the pressure that you're making between the front leg and the back leg. See if you can even out the amount of weight that you're putting on each foot. So you're going to find the center. Look straight ahead. And feel free to touch the chair. I'm going to point the camera up so you can see me more. So keep the feet right there. And we're going to try to turn your head up to the ceiling if you can. And down to the floor, if you can. We're nice and slow a few more times. It shows you how turning your head, how it really changes your balance. If you have neck pain with this, don't go as much or don't do it at all. And then we'll look straight ahead. Try to regroup. If you notice you're shifting your weight again, try to get the weight equal in between the front leg and the back leg. And then we'll slowly turn your head right and left. Trying to keep your balance. And then we'll look straight ahead. And this is going to be challenging. So if feel free to touch the chair the whole time or not do it at all, or bring your foot back a little bit. But we're going to try closing your eyes if you feel like you can. So this is probably one of the more challenging exercises for today, I think. For some people. Whenever you need to open your eyes, touch the chair, take a step by all means. Okay, let's open our eyes. You can separate your feet. And we're going to do the other side. So we'll feet together. We'll slide the left foot partially forward. Try to find the equal balance between the front leg and the back leg. Look straight ahead. And we'll start to look up and down a few times. So up and down and up, down. One more up. One more down, and look straight ahead. Get the balance again. And then we'll slowly look right and left. One more. All right, let's look straight ahead. I'm going to try the eyes closed again. Touch the chair if you need. A trick could be to look at a point in front of you, and before you close your eyes, keep looking at that point, and when you close your eyes, imagine that you're still looking at that point in front of you. That can help, or maybe not. Can't hurt. All right, let's open our eyes. If you haven't already, bring the feet apart. Looks good. Aaron, anything come up question-wise?
Not pertaining to those per se, but in general, yes. But I wanted to, before I get into the final questions, I wanted to open it up to the floor to see if there's any other questions pertaining to what Justin just showed us. If anybody wants to unmute themselves and ask a question, feel free.
Dorothy.
I'm a dog again. Oh boy, now it just went out of my mind. Oh, it was really more of an observation. When you brought it up at the end, pick a point and stare at that point, or have that point in your mind as your focus. I find that any balance exercise I've ever tried, if I'm looking at myself in the mirror, it's out. I can't do it. So don't try to look at yourself. Try to look at some focus point anywhere.
Yes.
The molding on the ceiling, it doesn't matter.
Try not to look at yourself on Zoom either. That's hard too.
I would imagine, yeah, it's hard. I don't know how dancers do it, except they know their center so well. Thank you.
Thank you, Dorothy.
Have a question?
Yep, Adele.
Sure.
Is it a good idea before you get out of bed in the morning, or as you're getting out of bed, to do those massaging exercises for you to wake up your feet and your legs and stuff?
Yeah, definitely. Or even pumping your feet up and down. It's a good way to get the blood flowing.
Right.
Especially if you're prone to getting a little dizzy if you stand up. If maybe your blood pressure drops a little bit as you stand. All those kind of that I think it's a good technique.
And is it normal to have a little tightness in the calves?
Oh yeah. Yeah, just means you gotta stretch more usually, you know. If it's painful, if it's getting red, it's getting warm, then you want to see a doctor about it.
No. It's just tight.
Yeah, tight.
Thank you.
Mine's tight too.
Okay. That makes me feel better.
I heard once about standing on one foot at a time, like if I'm watching TV, I put the one leg up and I try to stand on one leg. And if I can do it for a minute, then try the next time to do it a little longer and do it on both legs. It seems like that really helps my balance, standing on one foot at a time.
Yeah, that's hard.
It's hard, but it works.
Yeah. I frequently hear clients tell me that their doctors, when they say they have problems with balance, that they recommend standing on one leg while you brush your teeth. I don't know if any of y'all heard that, but it's a common exercise. I guess the motion and the standing on one leg, that seems challenging to me. That's a thought.
That's good.
Yeah.
Can I ask a question?
Sure.
If someone has a torn meniscus, is that something we need to be special in consideration in these exercises?
Yeah, some of the exercises would probably need to be more tailored to you, or things you might want to avoid depending on stuff that's more like bending the knee and maybe doing some squats or rotating, things like that.
Okay.
But if it's not, a lot of the stuff we did, I wouldn't expect too much trouble.
Okay, thank you.
Sure. I do want to, before you guys leave, I co-lead a balance and exercise class every Friday at 3 o'clock. Aaron, do you have that link to?
Yeah, I'm gonna throw it up now.
Yeah, so if anyone, it's $20 a class, it's on Zoom. It's similar to what we did, but I co-lead it with a personal trainer. She's amazing. We both kind of go back and forth during the class. There are small amount of attendees, so it's a little more personalized, where we can actually see what you're doing and provide feedback. So if anyone's interested, Aaron just posted the link on how to sign up. Yeah, I guess.
Thank you.
Sure.
Final question for you, Justin. I mean, the city streets could be treacherous, and for people that have a history of falls, either inside the home or outside the home, at what point do you think that they should get assessed for a assistive device, either a cane or a rollator or a walker? Because there's sometimes a lot of resistance to that, and I just wanted to ask if you had any advice as to when someone should seek using that assistive device.
It's a tough question, because I dislike assistive devices, because for a lot of people, they kind of throw you off. Maybe even especially a cane can sometimes make it even more of a fall risk or an injury prone. But it's, some people do great in it. So I think I would recommend getting evaluated by a physical therapist, especially someone that specializes in balance and mobility, and they can help kind of assess where you're exactly having the problems with your balance and stability. And then they can recommend if an assistive device, and what assistive device is recommended. Not everyone is going to be good with a cane, and not everyone needs a walker, of course. You know, it's very individual. Yeah. I hope that answered the question.
No, that's great. One more came in here. The difference between vestibular and balance and gait therapy, or is it the same thing?
There's a lot of overlap. Vestibular therapy is related to mainly balance and or dizziness, and and I guess gait therapy is working specifically on your walking, and balance therapy on your balance. So vestibular therapy kind of, they all can be kind of the same, but with vestibular therapy, there's more related to dizziness and then vertigo. But mainly vestibular therapy, if would balance and gait would be a component of it.
Got it.
Great class.
Thank you.
Fantastic, Justin. Thank you so much. This was really helpful. Some of these exercises I know are gonna help improve people's balance. So thank you so much for your time, and thank you everybody for joining us for another successful installment of the H&D webinar series. We look forward to seeing you guys again next month. Stay tuned for the topic, and until then, stay safe, and God bless.
Did you already post the
very much.
the telephone number?
Yes, check the chat. You'll see a link to the website and a way to sign up for Justin's class. And if you get confused, just call the office and we'll walk you through it.
Okay. Thank you.
Thank you.
Okay, everyone.
Bye, everyone.
Bye. Thank you.
Bye.